GLP-1 Therapy, a new hope for Alzheimer's disease. Introduction. Recent studies have shown that glucagon-like peptide-1 GLP-1 receptor agonists primarily used to manage diabetes may hold promise in treating Alzheimer's disease AD. The potential for these drugs to offer neuroprotection and cognitive benefits has garnered significant interest, leading to numerous clinical trials and research studies aimed at understanding their effects on AD pathology and cognitive decline. The mechanisms of action. 1. Neuroprotective effects. GLP-1 receptor agonists have demonstrated neuroprotective properties in various animal models of AD. They may mitigate the toxic effects of amyloid-beta, A-beta, and tau proteins, which are crucial in AD pathology. This protection could be attributed to several mechanisms, including reduced neuroinflammation, improved neuronal communication, and enhanced synaptic plasticity. 2. Improvement of metabolic functions. GLP-1 receptor agonists can enhance glucose metabolism and insulin sensitivity, which are often impaired in individuals with AD. By normalizing glucose processing in the brain, these drugs may help mitigate some cognitive deficits associated with the disease. 3. Reduction of inflammation. Chronic neuroinflammation is a hallmark of AD. GLP-1 receptor agonists have shown the ability to reduce inflammatory markers in the brain, potentially leading to improved neuronal health. Clinical evidence. 1. Preclinical studies. Numerous studies have indicated that GLP-1 receptor agonists can reduce A-beta accumulation and tau hyperphosphorylation in animal models of AD. For instance, studies have shown that exenatide, a GLP-1 receptor agonist, can lower A-beta levels and improve cognitive function in rodents. 2. Clinical trials. A significant trial reported at the Alzheimer's Association International Conference in 2024 examined liraglutide's effects on cognitive decline in patients with mild AD. This Phase 2b trial included 204 participants and found that liraglutide reduced brain shrinkage in areas critical for memory and decision-making by nearly 50% compared to placebo. Moreover, those treated with liraglutide experienced an 18% slower decline in cognitive function over 1 year. 3. Systematic reviews. A systematic review of existing clinical studies found that while GLP-1 receptor agonists did not significantly alter A-beta or tau biomarkers, they showed promising metabolic benefits such as improved glucose metabolism and reduced body weight. These findings suggest that while immediate cognitive improvements may not be observed, the long-term benefits of metabolic regulation could play a crucial role in AD management. Key clinical findings. Liraglutide, in the ELAD trial. Liraglutide treatment led to a significant reduction in brain volume loss in critical areas associated with cognitive function. Patients receiving liraglutide showed a notable decrease in cognitive decline compared to those on placebo, although the primary endpoint, cerebral glucose metabolic rate, was not statistically significant. Dulaglutide. Another study indicated that dulaglutide, which has a higher brain penetration rate than other GLP-1 agonists, may provide cognitive benefits evidenced by a reduced hazard of cognitive impairment over time in patients with type 2 diabetes. Exenatide. In a pilot study, exenatide demonstrated an ability to improve short-term memory in patients with AD, although results were variable and required further investigation. Challenges and future directions. While the results are promising, several challenges remain. 1. Insufficient evidence. While there is evidence of metabolic benefits and potential neuroprotection, the direct effects of GLP-1 receptor agonists on cognitive function in AD patients are still under debate. More extensive and longer-term studies are needed to establish definitive conclusions. 2. Variability in response. Not all patients respond similarly to GLP-1 receptor agonists, necessitating personalized treatment approaches. 3. Further research required. Ongoing trials such as the EVOKE studies assessing semaglutide aim to clarify the efficacy of GLP-1 receptor agonists in diverse AD populations, including those with mixed dementia. Conclusion. GLP-1 receptor agonists represent a promising avenue for AD treatment, potentially addressing both metabolic dysfunction and neurodegenerative processes. While definitive evidence of their cognitive benefits is still emerging, the existing research highlights their potential role in slowing cognitive decline and providing neuroprotection. Continued investigation into these drugs could pave the way for innovative treatment strategies that enhance the quality of life for AD patients and address the underlying mechanisms of the disease. References: 1. Fessel J. et al. 2024. GLP-1 Agonists and Alzheimer's Disease, A Comprehensive Review. J. Clin Med. 2. Alzheimer's Association International Conference 2024. GLP-1 drug liraglutide may protect against dementia. 3. Liang Y et al. 2024. Clinical Evidence for GLP-1 Receptor Agonists in Alzheimer's Disease, A Systematic Review. J. Alzheimer's Disrep. This report summarizes the potential of GLP-1 therapy in treating Alzheimer's disease, highlighting both the mechanisms through which these drugs may act and the clinical evidence supporting their use. Further research will be crucial in determining their effectiveness and integrating them into treatment protocols. The content presents a discussion on the potential of GLP-1 receptor agonists, particularly focusing on their use in treating Alzheimer's disease AD. Here are some counterintuitive insights drawn from the material. 1 is expectation versus evidence. There is a prevailing expectation that GLP-1 receptor agonists, which are primarily used for diabetes management, would have a direct and significant impact on Alzheimer's pathology by reducing amyloid-beta and tau levels. However, clinical studies have largely shown no significant changes in these biomarkers, challenging the assumption that targeting these pathways will necessarily lead to cognitive improvements. 2. Cognitive benefits versus biomarker changes. While many studies report metabolic benefits and some cognitive improvements associated with GLP-1 therapy, they do not correlate with significant reductions in amyloid or tau pathology. It suggests that cognitive function may improve through mechanisms unrelated to direct effects on these pathological hallmarks of AD, which contradicts the common belief that lowering amyloid-beta or tau would directly enhance cognitive outcomes. 3. Dulaglutide's prominence. Dulaglutide is highlighted as having the highest brain penetration among GLP-1 agonists, leading to expectations of superior cognitive outcomes. Yet it is noted that only one significant study has been conducted on its cognitive effects, raising questions about the generalizability of findings across different GLP-1 agonists. For short-term versus long-term effects, many trials focus on short-term outcomes, yet the progression of Alzheimer's is a long-term process. This discrepancy raises doubts about whether short-term cognitive improvements can be sustained or lead to meaningful long-term benefits, countering the notion that early intervention with GLP-1 agonists will necessarily yield enduring cognitive preservation. 5. Gastrointestinal side effects. While GLP-1 agonists are generally well tolerated, the high incidence of gastrointestinal side effects may lead to discontinuation of treatment. This complicates the expectation that these drugs can be widely used in the AD population, who may already be vulnerable. 6. Animal studies versus human trials. The efficacy demonstrated in animal models of AD does not always translate to human studies, which is a common assumption in translational medicine. This discrepancy emphasizes the need for caution in extrapolating animal data to human clinical outcomes. 7. Metabolic improvements without cognitive gains. The reported metabolic benefits, such as improved glucose metabolism and weight management, do not inherently lead to cognitive improvements in AD patients, challenging the assumption that managing metabolic health will automatically confer cognitive benefits in this population. 8. Repurposing drugs. The notion of repurposing existing drugs like GLP-1 agonists for new indications like AD is often seen as a shortcut to effective therapies. However, the mixed results from clinical trials indicate that repurposing may not be as straightforward as anticipated, underscoring the complexities of neurodegenerative diseases. 9. Therapeutic window. The timing of intervention with GLP-1 agonists in the disease process is critical. Early intervention is often posited as beneficial, yet the data suggest that the optimal timing for initiating therapy may not be well defined and treatment might not be effective if started too late in the disease progression. 10. Individual variability. There is significant variability in responses to GLP-1 agonists among individuals with AD, which counters the expectation of uniform effects. This highlights the need for personalized approaches to treatment. Recognizing that one-size-fits-all strategies may not be effective in neurodegenerative diseases. These points illustrate the complexity and unpredictability of drug responses in Alzheimer's treatment and highlight the need for ongoing research and a nuanced understanding of how GLP-1 receptor agonists may fit into the broader therapeutic landscape for Alzheimer's disease. In the emerging discourse surrounding the potential of GLP-1 glucagon-like peptide 1 receptor agonists in treating Alzheimer's disease, several key points present important insights that warrant careful consideration. 1. Neuroprotective mechanisms. While many reports focus on the cognitive outcomes of GLP-1 therapy, the underlying neuroprotective mechanisms are often overlooked. For instance, GLP-1 receptor agonists such as liraglutide and dulaglutide may exert beneficial effects by reducing neuroinflammation and apoptosis, enhancing synaptic plasticity and improving neuronal communication. These mechanisms are critical because they address the pathological processes of neurodegeneration and could potentially slow the progression of Alzheimer's even if direct cognitive improvements are not immediately evident. 2. Differential drug efficacy. The distinction between various GLP-1 receptor agonists is significant but frequently minimized. For example, dulaglutide has been found to have superior brain penetration 61.8% compared to liraglutide and semaglutide, which may explain its more pronounced effects observed in clinical trials. This suggests that the pharmacokinetics of these drugs could play a crucial role in their effectiveness, and thus future studies should consider the specific properties of each GLP-1 receptor agonist when evaluating their therapeutic potential for Alzheimer's disease. 3. Cognitive decline versus structural changes. The Phase 2b trial of liraglutide highlighted that while there may not be immediate cognitive improvements, significant reductions in brain volume loss were observed, particularly in areas responsible for memory and cognition. This finding is crucial because it indicates that even in the absence of overt cognitive gains, the preservation of brain structure may contribute to long-term cognitive health. The relationship between brain atrophy and cognitive decline underscores the need for a comprehensive approach to measuring treatment efficacy, which should include both structural and functional assessments. For metabolic benefits, the metabolic effects of GLP-1 receptor agonists are often overshadowed by their neuroprotective potential. However, their ability to improve glucose metabolism and manage weight may not only benefit patients with diabetes but could also play a role in mitigating the risk factors associated with Alzheimer's disease. This connection between metabolic health and cognitive function is a critical area that deserves further exploration, as it could lead to integrated treatment approaches addressing both metabolic and neurodegenerative pathways. 5. Clinical trial limitations. Many of the studies conducted thus far have been limited in scope, either due to small sample sizes or short durations, which may not adequately capture the long-term benefits or side effects of GLP-1 therapy. The systematic review noted that while some trials indicated metabolic improvements, they did not show significant changes in amyloid or tau biomarkers. This discrepancy highlights the need for larger, well-designed trials that can assess both the short and long-term effects of GLP-1 receptor agonists on Alzheimer's disease pathology. 6. Adverse events reporting. The gastrointestinal side effects associated with GLP-1 receptor agonists, such as nausea, are frequently noted but may not be adequately contextualized within the overall benefit-risk profile of these therapies. Understanding how these side effects impact patient adherence and overall treatment outcomes is crucial for the clinical application of GLP-1 therapy. In summary, the discussion surrounding GLP-1 receptor agonists and Alzheimer's treatment is multifaceted, encompassing neuroprotective mechanisms, differential drug efficacy, structural brain changes, metabolic benefits, clinical trial limitations, and the impact of adverse events. Each of these elements is significant not only for advancing our understanding of Alzheimer's disease pathology but also for developing targeted therapeutic strategies that may enhance patient outcomes. Future research should prioritize a holistic view that incorporates these factors to better evaluate the potential of GLP-1 therapies in clinical settings. The potential of GLP-1 glucagon-like peptide 1 receptor agonists in the treatment of Alzheimer's disease AD has garnered significant interest in recent years. Here are 4 valuable points for in-depth analysis and discussion based on the provided content. 1. Neuroprotective mechanisms of GLP-1 agonists. GLP-1 receptor agonists exhibit neuroprotective effects that could be pivotal in addressing the pathophysiology of Alzheimer's disease. Research highlights their ability to mitigate neuronal apoptosis, enhance synaptic plasticity, and promote neurogenesis. For instance, studies have shown that GLP-1 receptor activation can reduce the toxicity associated with amyloid-beta A-beta plaques and tau neurofibrillary tangles, which are key pathological features of AD. Specifically, liraglutide has demonstrated a significant brain penetration rate of 61.8%, suggesting a strong potential for cognitive improvement through direct actions on neurons and other brain cells. Analyzing the specific pathways through which GLP-1 agonists exert these neuroprotective effects could provide insights into novel therapeutic targets for Alzheimer's and other neurodegenerative diseases. 2. Clinical trial outcomes and cognitive benefits. The results from recent clinical trials, particularly the Phase 2b trial of liraglutide, indicate a promising role for GLP-1 agonists in slowing cognitive decline in patients with mild Alzheimer's disease. The trial reported a significant reduction in brain atrophy associated with cognitive functions such as memory and decision-making, suggesting that liraglutide may protect crucial brain regions from degeneration. The observed 18% slower decline in cognitive function compared to placebo underscores the potential of GLP-1 therapies as a viable strategy to enhance cognitive outcomes in AD patients. A detailed discussion on the implications of these findings, as well as the need for further large-scale studies to confirm sustained cognitive benefits, is warranted. 3. Metabolic and neuroprotective effects beyond cognitive function. While the primary focus of GLP-1 agonists has been on their cognitive benefits, they also exhibit significant metabolic advantages such as improved glucose metabolism and weight management. This is particularly relevant as metabolic dysregulation is a common feature in both type 2 diabetes and Alzheimer's disease. The systemic review noted that while GLP-1 receptor agonists did not significantly alter A-beta and tau biomarkers, they demonstrated promising metabolic benefits, including lower body mass index and improved glucose levels. This raises important questions about the interconnectedness of metabolic health and neurodegeneration, suggesting that GLP-1 agonists may serve a dual purpose in treating AD by addressing both cognitive decline and underlying metabolic dysfunction. 4. Need for further research and exploration of different GLP-1 agonists. Despite the encouraging findings, the current evidence surrounding GLP-1 receptor agonists remains limited, with some studies failing to show significant changes in cognitive outcomes or AD biomarkers. A systematic review highlighted the inconsistency in outcomes across various trials, particularly concerning the impact of different GLP-1 agonists on cognitive function and AD pathology. Thus, further research is critical to establish the efficacy of various GLP-1 agonists, including liraglutide, dulaglutide, and semaglutide, in larger and more diverse populations. Future studies should also explore the mechanisms of action, optimal dosing regimens, and potential side effects to ensure a comprehensive understanding of their therapeutic potential in Alzheimer's disease. In summary, while GLP-1 receptor agonists present a promising avenue for Alzheimer's disease treatment, ongoing research is essential to fully understand their mechanisms, benefits, and limitations, ultimately paving the way for novel and effective therapeutic strategies. Here are 3 famous historical cases that illustrate the potential of repurposing existing medications for new therapeutic uses, akin to the exploration of GLP-1 therapy for Alzheimer's disease. 1. Aspirin in cardiovascular disease. Initially developed as a pain reliever and anti-inflammatory agent, aspirin's cardiovascular benefits were discovered in the 1980s. Research indicated that low-dose aspirin could reduce the risk of heart attacks and strokes by inhibiting platelet aggregation. This finding led to widespread use of aspirin for primary and secondary prevention of cardiovascular diseases, demonstrating how a drug can be successfully repurposed based on emerging scientific evidence. 2. Minoxidil and hair loss. Minoxidil was originally developed as an oral medication for hypertension. During clinical trials, researchers observed an unexpected side effect: hair growth in patients. This led to the repurposing of minoxidil as a topical treatment for androgenetic alopecia, male and female pattern baldness. It became the first FDA-approved medication for hair loss, highlighting how unexpected results from clinical observations can lead to new therapeutic applications. 3. Thalidomide for multiple myeloma. Thalidomide was initially marketed in the late 1950s as a sedative and treatment for morning sickness in pregnant women, but it was withdrawn after causing severe birth defects. Years later, researchers discovered that thalidomide had anti-inflammatory and anti-angiogenic properties, leading to its use in treating multiple myeloma and other conditions. This case exemplifies the complexities of drug safety and the potential for drugs to be redeveloped for entirely different medical conditions after thorough investigation and re-evaluation of their mechanisms of action. These historical examples underscore the possibilities inherent in drug repurposing, reflecting the hope surrounding GLP-1 receptor agonists in the treatment of Alzheimer's disease. The future outlook for GLP-1 glucagon-like peptide 1 therapy in the treatment of Alzheimer's disease AD appears promising, driven by ongoing research and evolving clinical evidence. The following predictions outline potential developments in this field over the next several years. 1. Increased clinical trials and research. As interest in GLP-1 receptor agonists grows, we can expect a surge in clinical trials aimed at assessing their efficacy in AD. Ongoing trials such as the EVOKE studies evaluating semaglutide's effects in early AD will likely yield valuable data, further informing treatment protocols. 2. Refined understanding of mechanisms. Future research will likely elucidate the complex mechanisms through which GLP-1 agonists exert neuroprotective effects. This could include a better understanding of how these drugs modulate neuroinflammation, improve glucose metabolism, and impact amyloid-beta and tau pathology, ultimately leading to more targeted therapies. 3. Potential for combination therapies. It is plausible that GLP-1 therapies will be combined with other emerging treatments for AD, such as anti-amyloid antibodies, e.g. lecanemab, or tau-targeting agents. This multifaceted approach could optimize therapeutic outcomes by addressing various aspects of AD pathology simultaneously. For personalized medicine approaches, the future may see the integration of personalized medicine in the use of GLP-1 therapies for AD. Genetic and biomarker profiling could help identify patients who are more likely to benefit from these treatments, enhancing their efficacy and minimizing adverse effects. 5. Regulatory approvals and clinical adoption. If ongoing and upcoming trials confirm the efficacy and safety of GLP-1 agonists in AD, we may see regulatory agencies approving these drugs for use in dementia care. This would facilitate their incorporation into standard treatment protocols for patients with cognitive decline. 6. Broader understanding of comorbidities. GLP-1 therapies known for their benefits in type 2 diabetes are likely to be studied further in the context of metabolic syndrome and obesity, both of which are linked to increased AD risk. This expanded understanding may lead to more comprehensive treatment strategies that address both metabolic health and cognitive function. 7. Focus on long-term outcomes, as more data emerges from long-term studies. There will likely be an emphasis on understanding the sustainability of cognitive benefits conferred by GLP-1 therapy. This could lead to insights into the long-term management of AD and potential prevention strategies. 8. Advancements in formulations. Innovations in drug delivery systems may enhance the effectiveness of GLP-1 therapies, such as developing oral formulations or extended-release injectable formulations that improve patient compliance and outcomes. 9. Increased awareness and education. As research progresses and results become available, there will likely be increased awareness among healthcare providers and patients about the potential benefits of GLP-1 therapies for AD. Educational initiatives may help integrate these treatments into clinical practice. 10. Global collaborations and research networks. The international collaboration among researchers, institutions, and pharmaceutical companies will likely accelerate the pace of discovery in this area. Global research networks may facilitate the sharing of data and resources, leading to faster advancements in GLP-1 therapy for AD. In summary, the future of GLP-1 therapy in Alzheimer's disease treatment looks optimistic, with expectations of expanded research, potential regulatory approvals, and integration into comprehensive treatment strategies. Continued exploration of its mechanisms and effects will be vital in determining its role in managing this complex and challenging condition.